The TMJ TMD conundrum is real and has been puzzling the dental and medical professions for decades. This is the TMJ TMD Demystified Podcast with Dr. Tony Urbanek, where we'll connect the dots between TMD symptoms and the actual cause. We'll tackle common TMD misconceptions and educate you, the practitioner, about a simple, tested, and proven TMD solution that has already provided relief to thousands of patients, while helping practitioners build an additional source of income free from insurance control. Welcome to this episode of the TMJ TMD Demystified Podcast.
Hello, TMD warriors. I am Tony Urbanek, and we are gathered here for the next episode of TMD Demystified. Today's presentation is going to be somewhat personal on my side. As I have stated many times, I write a blog parallel to my weekly podcast. And this week, my blog was entitled, Why I Chose to Treat TMD, TMJ, Rather Than Retire. And so today, the title of this episode is Why I Choose to Treat TMD, TMJ, Rather Than Retire. Everyone has a purpose or has the right to choose a purpose in life. Looking back at my career and starting when I was a young man, I can see that what my purpose was. My purpose was to lead a challenging, exciting life by helping others. And I have pretty much succeeded in doing that as an oral and maxillofacial surgeon. Some of you, in fact, most of you who watch this may not know much about my past history, but as a oral and maxillofacial surgeon, I went first through dental school, then a separate degree in cell biology and anatomy, and then medical school, internship, residency in oral maxillofacial surgery. Had a fellowship grant from the NIH, NIDCR, National Institute of Dentistry and Craniofacial Research on facial growth and development, using lasers to create animal models with facial defects using intrauterine fetal surgery, which was quite a feat, and proved that you could do that. But instead of going academic like I originally thought I would do, I stayed in private practice and had what I consider, maybe not others consider, but I consider having a spectacular practice for roughly 50 years in oral and maxillofacial surgery in the Nashville area. Basically 25 years in the hospital district in downtown Nashville, and the last 25 years out here in Williamson County, just south of Nashville, in Franklin, Brentwood, Cool Springs, Tennessee. Now, why do I choose to continue to treat TMD, TMJ rather than retiring? And I am well past retirement age. As some of you might suspect, due to the color of my hair or some of the lines on my face, I'm well past retirement age, standard retirement age. But along the way, in that 50 years of surgical experience, I had the opportunity to treat temporomandibular joints surgically for 36 years, over 2,000 times, 2,000 separate cases. And roughly half of those cases were open joint cases, incision in front of the ear, various types of surgery within the temporomandibular joint, and half of them were through a arthroscopic surgery. Along that way, over that first 36 years and 2,000 cases, what I observed, and I had done every possible type of temporomandibular joint surgery, some of them many, many times, one in particular over 800 times. In fact, I think well over 800 times, which was designated the Christensen implant, partial glenoid fossa reconstructive procedure, which in my hands and my experience was the most successful that I had ever done. But still, the arthroscopic was, generally speaking, not so successful. What I did observe was that no matter what kind of surgery that I was performing, somewhere between 30 and 40% of the time, depending on the surgery itself. Christensen was a little different. We only had probably about 10% of the patients return, but patients would return fairly routinely within a year or two with the same symptoms. And again, some procedures were better than others. Some I did not perform but once or twice because of the less than spectacular results. And with that experience in mind, roughly 14 years ago, I decided not to do any more temporomandibular joint surgery, and my surgical experience was limited to orthognathic surgery, cleft lip and cleft palate, cancer reconstruction, trauma and trauma reconstruction, microneurosurgery, of various kinds. But the temporomandibular joint surgery was eliminated very rapidly. And at the same time, I decided to see, rather than give up on trying to find a solution for temporomandibular joint problems, the enigma conundrum of temporomandibular joints, of which it was obvious that neither the general dental community or the surgical community within dentistry had any idea how to solve the problem. Certainly the medical community did nothing more than pretty much misdiagnose the problem continuously, confusing the symptoms of temporomandibular joint surgery with many, many other kinds of medical diagnoses, primarily confusing TMD with migraine headaches, sinus headaches of different varieties, which my medical colleagues have a hard time differentiating the different types of headaches. Confusing TMD with Meniere's disease, ringing in the ears, subjective hearing loss and fullness in the ears, and dizziness vertigo, which is Meniere's disease, and which ENT doctors have no solution for, and they admit it. And then, the thousands, in my experience, of misdiagnosis of ear aches, ear infections for what was obvious TMD, and many other misdiagnoses that have been made because of neck pain, upper back and shoulder pain, was misdiagnosed as cervical disc problems, arm, hand, finger tingling and numbness, very commonly misdiagnosed as something else. So the problem is all these disparate symptoms of temporomandibular joint were misdiagnosed by the medical doctors, ignored or untreated or mistreated by the dental doctors, who did various things to teeth that were not successful, and everyone knew it. It was, and currently is the consensus out there that when it comes to TMJ, nothing works. It's a very complicated problem. You have to be a very complicated doctor to treat it. And if anybody ever finds a solution, it's going to be a very complicated solution. Well, all of those statements are not true. And beginning 14 years ago, I took on the challenge myself to see if I could figure out what the heck is going on. And I'm not going to go through the litany. It's definitely placed elsewhere, what I discovered, how I discovered it. That's been described in detail at many other parts of the podcast and episodes of the podcast. But what I want to focus on is why I'm still in this. So I did challenge myself. I did find the common denominator, which is chronic inflammation in the joint. Spoiler alert, if you can get rid of the chronic inflammation continuously, all the symptoms will go away. But the reason I'm in it is for the patients. And these patients, and this is the point of this episode, these patients have been abused by our system. And no one is speaking up about the abuse and trying to correct it yet, except myself and a few others who see the value in doing a simple process, using a simple procedure and device that unloads the temporomandibular joint adequately over a period of time, according to protocol, which allows the chronic inflammation to dissipate. Once it dissipates, then all the symptoms go away, and then you're left using the device and protocol for the rest of your life, which keeps the inflammation away. But the problem is the misdiagnosis from the medical community and I have to use the words, comes up, the ignorance of the dental community, thinking it's complicated, being taught in dental school that it is a complicated disease. The consensus that is there is no solution, which I just outlined what the solution is. And the millions of women who are burdened by these disparate symptoms, which brings them to desperation. And every week, almost every day, but certainly multiple times during a week, because we are very, very busy with these patients here in Middle Tennessee, I am confronted by women who tell me their stories, and I hear the same things constantly. I wish someone had told me about this 20 years ago, 30 years ago. It brings to mind 2 patients this week, literally, who said almost verbatim, different patients, "You saved my life." And I know what they mean by this. I literally have patients saying that frequently. We have a few patients who actually were contemplating suicide because of the unresolved symptoms going from doctor to doctor to doctor, circling the practitioners, some of which offered solutions, of which those that were effective were only effective very temporarily. And I've talked many times about recently regarding the fact-checking on the different procedures and solutions that are offered out there. And some are effective, but only for very short periods of time. But you can refer back to prior fact-checking episodes. Today, I just am trying to answer why I'm still here. So I'm still here because of the patients, primarily women. It's primarily women because estrogen exacerbates inflammation. That piece of data has been in the scientific literature for well over 50 years, probably closer to 70 years now. Well known, but the practitioners don't know that. The dentists certainly don't know that. Most physicians don't know that. Fibromyalgia is a female problem for the same reason the TMD is primarily a female problem, because estrogen exacerbates inflammation and keeps the chronic inflammation cooking in wherever that particular inflammation is centered. And we're left with this continuous problem of literally millions of women and some men, it's 10% men, 90% females, who go from doctor to doctor, getting misdiagnosed, mistreated, or misdirected, getting involved with things either intentionally or unintentionally. And I'm certainly not trying to criticize my dental or medical colleagues, because I think very few, very, very few of my dental or medical colleagues intentionally try to misdiagnose, mistreat, or misdirect patients. I have seen a few that actually know better, but continue to do it. But that is very few. I think highly of my dental and medical colleague professionals, and I think most of us got into the professions and stay in the professions for those idealistic reasons, to help people. But this particular problem, TMD, I believe kind of stands alone among